Prime Minister Narendra Modi speaks to Australian counterpart Scott Morrison. Both the leaders agree on the need to ensure affordable and equitable access to vaccines as well as medicines for containing COVID-19 globally. Centre provides 17.35 crore doses to states and union territories. More than 90 lakh doses are still available with states and union territories. States to receive over 10 lakh doses over the next 3 days. 11.81 lakh people received the first dose in the age group of 18 to 44 years so far. Union Health Ministry says COVID cases increasing in states like Karnataka, Kerala, Tamil Nadu, Andhra Pradesh, West Bengal, Bihar, Haryana and Uttarakhand. COVID cases are plateauing gradually in Maharashtra, Delhi, Rajasthan, Telangana and Jharkhand. Union Health Minister Dr. Harshvardhan reviews RML Hospital for clinical management of corona cases in Delhi. Indian Railways in action delivers 2,960 metric tons of liquid medical oxygen in 185 tankers to different states. 47 oxygen express trains have completed their journeys. Expected to arrive in MP, Haryana, Rajasthan and Delhi as well. Several states impose strict statewide lockdown. Ban wedding celebrations, shut all places of worship. Himachal Pradesh to impose 10 days curfew. Rajasthan clamps down 14 days lockdown. West Bengal issues new travel advisory to passengers travelling using trains. Compulsory 14-day institutional quarantine in Delhi for persons from Andhra Pradesh and Telangana. A 4-member fact-finding team of the Union Home Ministry meets Governor of West Bengal Jagdeep Dhankar in Kolkata over the post-poll violence in the state. The team visits different areas of North and South 24 Parganas affected by the post-poll violence. DMK Chief MK Stalin is sworn in as the Chief Minister of Tamil Nadu for the first time. In Puducherry, NDA-backed N. Rangasamy takes oath as Chief Minister. In West Bengal, newly elected MLAs take oath as members of the State Assembly. Ministry of Home Affairs panel meets Governor in Kolkata. Well, first up, Prime Minister Narendra Modi on Friday had a telephonic conversation with his Australian counterpart Scott Morrison. During the conversation, the PM conveyed his appreciation for the prompt and generous support extended by Australian government and people for India's fight against the second wave of COVID-19 pandemic. Both the leaders agreed on the need to ensure affordable and equitable access to vaccines as well as medicines for containing COVID globally. The PM sought Australia's support for the initiative taken at the World Trade Organization by India and South Africa to seek a temporary waiver under TRIPS in this context. Both the PMs took note of the progress made in the India-Australia Comprehensive Strategic Partnership since the virtual summit held on the 4th of June last year. They also discussed ways to further strengthen cooperation and foster people-to-people ties. During the conversation, the leaders even discussed regional issues and reiterated the importance of working together for a rules-based international order and a free, open and inclusive Indo-Pacific region. And Prime Minister Narendra Modi also spoke to Chief Ministers of Manipur, Tripura and Sikkim and reviewed the COVID-19 situation. According to sources, the PM's interaction with Chief Ministers is part of his exercise to deal with the pandemic situation. In the meeting, the PM reviewed various aspects of the COVID-19 response in the states and districts, including the ongoing vaccination drive. Earlier on Thursday, the PM had also spoken with the Chief Ministers of Andhra Pradesh, Odisha, Jharkhand and Telangana, besides Lieutenant Governors of Jammu and Kashmir and Puducherry in this regard. With a record 4,14,188 new coronavirus cases being reported in a day, India's infection tally has climbed to 2,14,91,598, while the active case count has crossed the 36 lakh mark according to the Health Ministry's data. At the same time, the Government of India is leading the fight against the COVID-19 pandemic in collaboration with states and union territories through a whole-of-government approach, including carrying out effective vaccination drives. The government has so far provided nearly 17.35 crore vaccine doses to states and union territories free of cost. Of this, the total consumption, including wastage, is around 16.44 crore doses. Over 90 lakh COVID vaccine doses are still available with the states and union territories to be administered. Furthermore, more than 10 lakh vaccine doses will be received in addition by the states and union territories within the next 3 days. Thus, the government has said that it has been noticed in some instances that citizens had booked their appointment for COVID vaccination through the CoWIN portal, but did not actually go for vaccination on the scheduled date. They received notification through SMS that a vaccine dose has been administered to them. Upon examination, it has been found to occur largely on account of the vaccinator wrongly marking the citizen as vaccinated. That is an instance of a data entry error by the vaccinator. In order to minimize such errors and the subsequent inconvenience caused to citizens, the CoWIN system is introducing a new feature of 4-digit security code in the CoWIN application starting tomorrow, that is Saturday. Now, after verification, if the beneficiary has been found as eligible before administering the vaccine dose, the verifier or the vaccinator will ask the beneficiary about his or her 4-digit code and then enter the same in the CoWIN system to correctly record the vaccination status. This new feature will be applicable only for citizens who've done an online booking for a vaccination slot. Now, Union Health Minister Dr. Harshvardhan visited IIMS Hospital today in the national capital to review preparedness for clinical management of COVID-19 cases. He also inspected the high-flow medical oxygen plant that has been set up by DRDO at the IIMS Hospital. Speaking to media persons after the visit, the Health Minister said the centre is making efforts to set up around 200 COVID beds, out of which 22 are specialised for ICUs. He added that with the help of this plant, 2.4 to 2.5 metric tons of oxygen will be generated.
यहाँ पर लगभग 200 नए बेड और उन बेड्स में 22 बेड्स विशेष रूप से आईसीयू के, ये हमने आज क्रिएट करने की दिशा में अपने प्रयासों को पूरा किया है और उस बेड्स के कॉम्प्लेक्स को आज हम लोगों ने विजिट किया है। इसके अलावा यहाँ पहले से ही ये जो सामने बिल्डिंग है और इसके साथ में एक और बिल्डिंग है, 2 बिल्डिंग्स में लगभग हमारे 205 बेड्स और जिसमें आईसीयू बेड्स भी हैं और दूसरे बेड्स भी हैं, सभी ऑक्सीजन सपोर्टेड, वो पहले से काम कर रहे हैं।
Now, overcoming all hurdles and finding new solutions, Indian Railways has been continuing its journey of bringing relief by delivering liquid medical oxygen to various states across the country. So far, Indian Railways has delivered more than 2,960 metric tons of LMO in 185 tankers to various states across the country. 47 oxygen expresses have already completed their journey so far. It is Indian Railways' endeavour to deliver as much LMO as possible in the shortest possible time to the requesting states. Till the time of this release, 174 metric tons has been offloaded in Maharashtra, 729 in Uttar Pradesh, 249 in Madhya Pradesh, 305 in Haryana, 123 in Telangana and 1,334 metric tons in Delhi. Presently, 18 tankers are on the run with more than 260 tons of LMO, which are expected to arrive in Maharashtra, Haryana and Delhi. Running of new oxygen is a very dynamic exercise and figures keep getting updated all the time. More loaded oxygen expresses are expected to start their journeys later in the night. Now, considering the requirement of Remdesivir in every state and ensuring its adequate availability, Union Minister for Chemicals and Fertilizers D.V. Sadanand Gowda today announced the allocation of Remdesivir made up to 16th of May 2021. This will ensure smooth supply of Remdesivir across the country so that no patient faces a difficulty in the pandemic times. The ministry in a statement said that all the allocation of vials up to the 16th of May is in continuation with the earlier allocation plan for the period between the 21st of April to the 9th of May. The ministry also said that an updated allocation plan valid for the period of 21st of April to 16th of May is prepared jointly by the Department of Pharmaceuticals and Ministry of Health and Family Welfare. According to the ministry, a total of 53 lakh vials of Remdesivir have been allocated to 36 states and union territories for the period of 21st of April to the 16th of May, which include 11,57,000 vials for Maharashtra alone. Meanwhile, the central government has asked the state governments and union territories to monitor proper distribution covering government and private hospitals as appropriate and in line with judicious use. The state governments and union territories have also been advised to place adequate purchase orders with the marketing companies immediately. The coordination with private distribution channels in the state could also be made. The ESR Hospital in Bihar subdivision of Patna district has been handed over to the Army starting today. The Army's 80-member medical team arrived in Patna on Thursday with essential medicines and equipment. This team consisted of 25 specialist doctors, nursing and paramedical staff. The decision has been taken by the central government in view of the increasing cases of COVID infection in Patna and of course in the state of Bihar. This will be converted into a 100-bed COVID hospital in the next 2 days. Soon, this ESR hospital will have a capacity of over 300 beds. Deputy Collector Ashok Tiwari has been made its nodal officer on behalf of the state government. Meanwhile, Patna has recorded the highest ever 3,665 COVID cases in past 24 hours, while the state recorded as many as 15,126 COVID cases. Around 13,364 people came out of the infection during the period as well. 90 people succumbed to the disease during the past 24 hours. Also, a contingent of 41 naval personnel from Western Naval Command comprising medical officers, nursing officers, paramedics and support staff has been deputed to the PMK's COVID Hospital Dhanvantari in Ahmedabad. This is in addition to a 57-member naval medical team already positioned at the hospital since the 29th of April. The team is being deployed for a period of 2 months and will assist the hospital administration in handling COVID patients. As many as 9,000 more beds are being set up in government hospitals across Tamil Nadu to combat the second wave of COVID-19. The health department officials have said about 4,000 additional beds were ready and this would be increased to 9,000 shortly. In Chennai, government facilities such as Omadurar Hospital, Rajiv Gandhi Government General Hospital, Stanley General Hospital and the Royal Peta General Hospital are among those that have got new beds. The number of beds with oxygen support is also being ramped up and around 900 postgraduate medical students have been roped in for containment efforts. On the long queues to buy Remdesivir, officials have warned private hospitals to not force patients to buy the drug if it's not absolutely needed. The health department will take action against private facilities if they create panic among patients regarding Remdesivir procurement. Health officials have also urged people not to visit tertiary hospitals without severe symptoms. A total of 24,898 persons tested positive for COVID-19 in Tamil Nadu yesterday. Besides, 195 deaths were also reported, while 21,546 patients got discharged in the last 24 hours. Now, to break the coronavirus chain, Himachal Pradesh, the government there has decided to impose 10 days corona curfew in the entire state from today onwards till midnight of the 16th of May. All government and private offices and establishments would remain closed during the curfew period, while all essential services such as health, electricity, telecommunication, water supply, sanitation and others would remain open during the period. Educational institutions in the state would remain closed till the 31st of May. Down south, Karnataka Chief Minister B.S. Yediyurappa held a review meeting with ministers and senior government officials today to review measures taken to mitigate the spread of COVID-19 in the state. The meeting was held after Prime Minister Modi met CMs of various states in a video conference on Thursday. Yediyurappa had earlier mentioned that a decision on whether or not to announce a total lockdown would be taken based on the PM's directions. Maharashtra Health Minister Rajesh Tope has said that in view of growing number of corona patients and the resulting strain on the health system, 100% recruitment in the health department has been approved. He added that 16,000 posts in various cadres will be filled immediately. 62,194 new cases were registered yesterday. 63,842 patients were also discharged, while 853 patients died in the last 24 hours. Currently, there are 6,39,075 active cases of COVID-19 in the state. Also, 38,26,089 people are in home quarantine and 29,406 patients are in institutional quarantine. In Rajasthan, the government has announced strict lockdown from the 10th of May to the 24th. This will start at 5 in the morning on the 10th of May. The state government has also put a ban on organizing weddings till the 31st of May. In rural areas, since several labourers have tested positive for COVID-19, all MG Narega related works will remain suspended till further orders. All religious places will remain closed during the lockdown, while all private and public vehicles except those engaged in medical services will remain off-road during the lockdown. Meanwhile, Himachal Pradesh has decided to impose 10 days corona curfew in the entire state from the 7th of May till the midnight of the 16th. All government and private offices and establishments would remain closed, while all essential services such as health, electricity, telecommunication, water supply, sanitation, etc. would remain open during the period. It was also decided that work would continue during corona curfew at civil work sites, horticulture, agriculture and other project sites. Educational institutions in the state would remain closed till the 31st of May. Passengers travelling by train are advised to follow COVID-19 appropriate behaviour while boarding, travel and at destination. The West Bengal government has issued advisory to train passengers to carry negative RT-PCR test report for a test conducted within 72 hours of train departure. Now, as COVID-19 cases continue to rise across the country, all persons arriving in the national capital from Andhra Pradesh and Telangana will have to undergo mandatory government institutional quarantine. This comes after reports of a more virulent variant in the virus found in Andhra Pradesh and Telangana that reportedly has a shorter incubation period and a higher transmission rate. According to the Delhi Disaster Management Authority, all passengers coming in by airlines, trains, buses, cars, trucks or any other mode of transportation will have to quarantine for 14 days at facilities established or identified by the district magistrates concerned. Any person who has successfully received both doses of the vaccine and produces a certificate to the effect, or has a negative RT-PCR report not older than 72 hours prior to undertaking the journey, will be allowed for home quarantine for 7 days. Action against violators will be taken under Disaster Management Act. Now, soon after its arrival from Italy, an oxygen plant was installed at ITBP Referral Hospital in Greater Noida in Uttar Pradesh. The plant can support around 100 beds at a time for COVID-19 patients admitted at the centre. In Delhi, Safdarjung Hospital received ventilators, oxygen cylinders, BiPAP machines and oxygen concentrators and other medical aid today. Medical Superintendent of Safdarjung Hospital said that the hospital has received these aids from Germany, France, UK, USA, Ireland, Abu Dhabi, Kuwait as well as Russia.
I wish to extend my gratitude for all the help coming from different countries all over the world in respect of providing ventilators, oxygen cylinders, BiPAP machines, oxygen concentrators, pulse oximeters, PPE kits, N95 masks and drugs, antiviral drugs and other drugs from all over the world with their great generosity, and that too in a short span of time. The countries from where we have received These aids are Germany, France, United Kingdom, United States of America, Ireland, Abu Dhabi, Kuwait, Russia, and France.
And the Lady Harding Hospital in the national capital has also received medical equipment from Russia, UK, UAE, US, France, Ireland and Romania. Hospital Director Enan Mathur said the oxygen cylinders will be used in the new 240-bedded facility. He added that currently the situation is under control, while 20% of our requirement was fulfilled by oxygen concentrators.
जिन देशों के इक्विपमेंट हमारे पास पहुँचे हैं वो हैं रशिया, यूनाइटेड किंगडम, आबू धाबी, यूएई, यूनाइटेड स्टेट्स ऑफ अमेरिका, फ्रांस, यूनाइटेड किंगडम अगेन, आयरलैंड, रोमानिया. और भी देशों के इक्विपमेंट जो हैं मैंने और अस्पतालों में दिल्ली में और भी जगह पूरे देश में पहुँचे हैं. ये जो है ये बहुत यूज़फुल रहा है हमारे लिए. सेकंड फेज़ में एक साथ स्टीप राइज हुआ. स्टीप राइज से सारा कोई भी सिस्टम किसी भी देश का हो वो चरमरा जाएगा, कितना ही रोबस्ट क्यों ना हो. ये किसी और डेवलप्ड कंट्री में भी हुआ होता इतना स्टीप राइज तो वो फ्लैट हो गया होता सिस्टम.
Now, similar reactions have also come in from Jharkhand, where people say that patients are recovering faster due to awareness created about COVID infection and the improvement in health facilities. Ranchi's Sahiba Arya and Shafali Gupta have also won one such war. They say that the key to beat coronavirus is family support along with practicing yoga regularly, maintaining high morale and following doctor's advice.
संक्रमण के दौरान मैंने सरकार के दी गए गाइडलाइंस को फॉलो किया, अच्छा खान पान किया, हल्का खाना खाया, प्रोटीन रिच खाना खाया, हल्दी वाला दूध, 4 से 5 बार भाप, काढ़ा और नियमित रूप से योगा प्राणायाम किया. इस चीज़ को मैंने 10 से 12 दिन किया. आप घर पे ही ठीक हो सकते हैं, इसलिए हिम्मत बनाए रखें.
कुछ दिन पहले कोरोना से संक्रमित हो गई थी. शुरू में तो मुझे बहुत भय प्रतीत हुआ, परंतु फिर गवर्नमेंट की गाइडलाइंस का पालन करते हुए अपने परिवार के सहयोग से मैंने कोरोना के खिलाफ जंग पर जीत हासिल की. दवाइयों के अलावा गर्म पानी का लगातार सेवन, स्टीम, गर्म चाय, कॉफी अथवा प्रोटीन रिच खाने से मुझे बहुत बेहतर महसूस होता था. साथ ही मैं आप सभी लोगों से यह कहना चाहती हूँ कि इससे घबराएं नहीं और पूरे विश्वास के साथ इसका मुकाबला करें.
Now, a 4-member central team led by Additional Secretary Govind Mohan called on West Bengal Governor Jagdeep Dhankar today morning at Raj Bhavan in Kolkata. The Ministry of Home Affairs team was with the Governor for over an hour. The team also visited violence-affected areas in Bengal and spoke to those affected. The team has been asked to submit a detailed report within 48 hours. Yesterday, the Ministry of Home Affairs sought a report from the Governor on the law and order situation in the state.
बंगाल को बांग्लादेश बनाने का साजिश चल रही है. पश्चिम बांग्लादेश, मुझे लगता है कि पश्चिम बांग्लादेश लगभग बन चुकी है. इतनी हत्याएं, इतनी बलात्कार, इतनी लूट खसोट, कहीं कानून व्यवस्था का नामो निशान तक नहीं है. गांव से शहर तक कहीं पर लोगों का जीवन सुरक्षित नहीं है. लगभग 20 के करीब हत्याएं हो चुकी है और दर्दनाक हत्याएं, महिलाओं के साथ बलात्कार और खून, पेट में टांग देना बलात्कार के बाद, और लोगों का घर तोड़ना, घर लूटना, दुकान लूटना, तालाब के मछली तक लूट लिया गया है. कितने हजार लोग घर छोड़कर बाहर हैं इसका कोई हिसाब नहीं अभी तक हमारे पास. बहुत डरे हुए लोगों का जिंदगी तहस नहस हो चुकी है बंगाल में.
Rashtriya Swayamsevak Sangh General Secretary Dattatreya Hosobole condemned the post-election violence in West Bengal. Hosobole stated that the despicable violent attacks on women, brutal killing of innocents, Arson and looting are completely against the spirit of democracy and the Constitution. He further added that these acts of violence are not only heinous in nature but also seem pre-planned. The RSS General Secretary also slammed the state government, playing mute spectator to the violence and its lethargy in putting an end to the chaos.
Violence unleashed statewide soon after the election results were announced is not only highly condemnable but appears to be well conspired also. The antisocial elements active in this abhorring violence misbehaved with women folk in most barbaric and despicable manner, brutally killed the innocent people and torched the houses, shamelessly looted the shops and malls. And as a result of the unabated violence, thousands of people, including a large number of brethren belonging to scheduled castes and tribes who became shelterless, were forced to go in search of refuge. The RSS condemns this gruesome violence in severest terms. This post-poll result violence is contrary to the Bharatiya tradition of coexistence and respect to the opinion of all, as also it is totally opposed to the very spirit of democracy and one people enshrined in our Constitution. That the role of state administrative machinery was completely passive and they remained mute spectators was the most heinous part of this unabated and inhuman violence.
And Union Minister for Housing and Urban Affairs Hardeep Singh Puri on Friday clarified as to why the government is still going ahead with the Central Vista project and the new Parliament building. In a series of tweets, the Union Minister slammed the Congress. He said the party's discourse on Central Vista is bizarre. He went on to add that the cost of Central Vista is about 20,000 crore rupees over several years. The Government of India has allocated nearly twice that amount for vaccination. Puri said India's healthcare budget for the current financial year was over 3 lakh crore rupees and that the centre knows its priorities. Hitting out at the Congress, the Union Minister in another tweet said, and I quote, "There are hundreds of projects being executed by various departments. Governance hasn't come to a standstill, unlike the Congress's times of policy paralysis. Central Vista is just another ongoing project. It's only the Congress that is obsessed about it, nobody else." Giving out details, the Union Minister said till now only projects for new Parliament building and rejuvenation of Central Vista Avenue have been awarded at an estimated cost of 862 crore rupees and 477 crore rupees respectively. He reiterated that there are many components in Central Vista project which are spread over several years. The minister further said that the Congress wants to distract people from monumental governance failures in their states by spreading lies. It's therefore indulging in cheap politics despite knowing this project creates direct and indirect employment for thousands of skilled, semi-skilled and unskilled workers in these times. DMK President M.K. Stalin today took charge as Chief Minister of Tamil Nadu at the Secretariat. Today in the morning, he was sworn in as Chief Minister of Tamil Nadu for the first time at a simple ceremony in Raj Bhavan in Chennai. He was administered the oath of office by Governor Banwari Lal Purohit. A 33-member Council of Ministers also took oath of office along with him. Stalin has retained a number of senior leaders in his cabinet, which also features 15 first-time ministers. Stalin has retained the important home portfolio with him, besides other departments including public, general administration and all India services. And in Puducherry close by, N. Rangasamy was sworn in as Chief Minister of the first NDA government in the Union Territory today after his state claimed to form the government. The oath of office was administered by Puducherry Governor T. Soundarajan. The rest of his Council of Ministers will be sworn in later after consultations among the NDA partners. The NDA has 16 MLAs, in which AINRC has 10 and the BJP has 6. This is Rangasamy's fourth tenure as Chief Minister and the first heading a coalition government. And that's all we have for the moment in this edition of the news. For the latest, do stay tuned to DD News and DD India.